Good afternoon, everyone. Good afternoon, everyone, and thank you for joining us on the news briefing this Wednesday, November 12th. You may have heard about plans for a mental health rehabilitation center project in the North Salinas area near Natividad Hospital. This project will allow people with specific needs to be treated at home near the support of their friends and family. Currently, there is no facility to help patients locally. There is a lot of information available about the project, and if you are interested in finding out more, there are some listening sessions set. We're very pleased to have staff from our behavioral health division of the health department. We have Melanie Rhodes and Fabricio Chombo, who are going to tell us more about the project and these listening sessions. Thanks for being here today.
Great, thank you. Thanks for having us. Fabricio and I are here to talk about the community outreach behavioral health has been engaging in. We are inviting feedback and community input on a proposed mental health rehabilitation center project that would bring 16-bed MHRCs, mental health rehabilitation centers, to Monterey County and the Central Coast region, expanding local treatment capacity for adults age 18 and older with a serious mental illness and/or co-occurring substance use disorder who are under LPS conservatorship. MHRCs provide 24-hour intensive support and rehabilitative services in a secure therapeutic setting to help residents regain stability and develop independent living skills with the goal of successfully transitioning back into their community. This project is for the development of the currently undeveloped county-owned parcel located at 1443 Constitution Boulevard in Salinas, across from the Salinas Regional Soccer Complex and adjacent to Natividad Hospital's Corral parking lot. We have emailed out information and gone door to door to share information with the neighbors near the project site, including a fact sheet, which Fabricio is sharing now, thank you, about the project, as well as an invitation to join us for one of the 3 community listening sessions that we will be holding. And the first of these sessions, is scheduled for tomorrow evening, the 13th at 6 p.m. The other listening sessions are listed there on your screen and will be held Monday, November 17th and Saturday, December 6th, also here. So the 13th and the 17th will be at 6 p.m. and the Saturday session will be at 10 a.m. as indicated there on your screen. All 3 listening sessions will be held in person at the Health Department Administration Building located at 1270 Natividad Road in the Whitney Conference Room. And there will be a Zoom option for those who would like to join remotely. And we will also have Spanish translation available. During these sessions, we will provide an overview of the project to include draft renderings so the community can see what is being proposed. And then we just really want to listen to the community and hear their thoughts, feedback, and input on the project. And we also will have our staff available to answer any questions that they have. So that's all we wanted to share today. Thank you so much. And we're happy to answer any questions right now if there are any after Fabricio provides in Spanish.
Muy bien, buenas tardes a todos y como dijo Melanie, estamos agradecidos porque nos tengan aquí hoy esta tarde. Nosotros estamos aquí para hablar sobre el alcance comunitario que nuestra oficina ha estado haciendo. Estamos invitando a la comunidad a darnos sus comentarios y aportes sobre el propuesto proyecto de un centro de rehabilitación de salud mental que traería 6 centros de 16 camas cada uno al condado de Monterey y a la región de la costa central, lo cual ampliaría la capacidad de tratamiento local para personas de 18 años o más que tengan una enfermedad mental grave y o trastorno por uso de sustancias concurrente que se encuentren bajo tutela según la ley LPS, por sus siglas en inglés. Estos centros proporcionan apoyo intensivo las 24 horas y servicios de rehabilitación en un entorno terapéutico y seguro para ayudar a los residentes a recuperar la estabilidad y desarrollar habilidades para tener una vida independiente con el objetivo de integrarse exitosamente de nuevo a la comunidad. Este proyecto está propuesto para desarrollarse en el terreno que es propiedad del condado, que actualmente está vacío y sin desarrollar. Está ubicado en el 1443 Constitution Boulevard, está enfrente del complejo regional de fútbol de Salinas y al lado del estacionamiento del Hospital Natividad. Como parte de estos esfuerzos, hemos enviado información por correo. Ay, déjenme, los comparto las imágenes un momento, por favor, en español. Ok. Hemos estado enviando información por correo y hemos ido de puerta en puerta para compartir información con los vecinos cercanos al sitio donde se está proponiendo este proyecto. También, este segundo documento aquí, proporcionamos una hoja informativa sobre el proyecto y también estamos invitando a la comunidad para que se una a nosotros a 3 sesiones de escucha comunitaria que realizaremos, la primera de las cuales está programada para mañana por la noche, a 13 de noviembre a las 6 de la tarde. Las otras sesiones de escucha se llevarán a cabo el lunes 17 de noviembre, igual a las 6 de la tarde, y la última el sábado 16 de diciembre a las 10 de la mañana. Estas 3 sesiones de escucha se realizarán en persona en el edificio de administración del Departamento de Salud, aquí en el 1270 Natividad Road, en Salinas, en la sala de conferencias Whitney, en el primer piso. Las sesiones también tendrán una opción para Zoom para quienes desean unirse de forma remota y todas las sesiones tendrán traducción al español disponible. En estas sesiones proporcionaremos una visión general del proyecto, incluyendo los diseños preliminares, para que la comunidad pueda ver lo que se está proponiendo. Pero en sí, realmente lo que queremos es escuchar sus comentarios, sus opiniones y aportes que tengan sobre el proyecto. Y también habrá personal disponible para responder a todas sus preguntas. De nuevo, queremos escuchar a la comunidad y también hemos agregado información a nuestro sitio web para incluir una manera para que los miembros de la comunidad se inscriban para recibir actualizaciones por correo electrónico sobre este proyecto si así lo desean. Y lo último es decirles que estamos programados para proporcionar una actualización a la mesa de supervisores el 9 de diciembre y en esa presentación compartiremos los comentarios que recibamos en estas sesiones con los supervisores y buscaremos más orientación sobre el proyecto. Muchas gracias.
Thank you both so much for walking us through this. 2 questions for you. For those who do not know yet about this project, could you briefly describe the value of what it will bring to the current situation we have in the county with people needing these services?
Sure. So right now, because we don't have this level of care placement available in Monterey County, this means that we have to refer folks out of the county and across the state for higher levels of care placement, which creates a challenge for their families to visit them, maintain connection, go to visit. And we also have our staff with behavioral health staff and public guardian's office staff who then are routinely traveling out of the county and across the state to follow up and help these clients transition to different placements and then also follow up and coordinate their care.
Thank you. And go ahead. Sorry, go ahead.
No, that's fine. I think there's this flow of patient flow also, because oftentimes what happens is because higher levels of care placement require referral, interview, coordination to help make that happen. Oftentimes we can see folks needing to wait for extended stays in hospital acute inpatient units when they're really no longer needing that level of care. So they're occupying a bed on an inpatient unit or perhaps waiting in an emergency department or something for transition to the appropriate level of care placement. So there's been a notable bed capacity issue across the state. And so that's, there's been an influx of funding through behavioral health continuum infrastructure grant funding that the state has made available to help support counties across the state and entities applying for funding to help increase the bed capacity because this is an identified need.
Thank you. And then next question, what have you heard from the community so far? You mentioned that you had been going door to door. What kind of feedback are you getting?
Yeah, we've gotten quite a range of feedback. And I think what we've really appreciated, and I'll just speak for myself, is I've really appreciated just the communication and the dialogue. There's been a lot of questions about the project, trying to understand really what is the population that is to be served here. And so it's really been that opportunity to help explain more and provide more information. We've heard some folks who are very supportive. We have heard from some folks who are also very concerned because it's, right behind their homes. And so they have lots of questions about what am I going to be looking at? Is it a 1-story or a 2-story building? Are people going to be out wandering around? And so we just want to be very transparent and provide all of this information because these are secured facilities. The plan is for the design is really single-story buildings and things. And so we have some renderings that have been drawn up that we want to share with the community and get their feedback on it because it's really not set up to be an institutional type facility, but more fit within the community and therapeutic, warm, welcoming treatment space.
And then one last question, is there a possibility to offer the services that will be provided at this facility to children under 18?
Actually, no, mental health rehabilitation centers are for adults 18 and older. So this isn't designed, this part of the programming isn't designed to serve minors or youth. So the MHRCs are specifically designed for 18 and older. Great question. Thank you for asking.
Thank you. That's all the questions we have. Thank you both for being here and walking us through this, and best of luck on your listening sessions.
Thank you.
Gracias.
Now for some good news. The Gonzales Library is moving. The current location on 5th Street is closing on November 22nd, but don't worry. The library is going to open in its new location in January in the brand new Gonzales Community Center, which is a fantastic project. And we're very pleased to have our library director, Hillary Thayer, here, and Patrick Dobbins, the city engineer with the city of Gonzales, to talk about this. Welcome to the briefing.
Thank you, Maya, and thank you for allowing us to come. I really appreciate you being here with me, Patrick, as this is a really just exciting project for the whole community of Gonzales. And though we're covering the details on the library, we're going to share just a few elements of the whole project, and there's going to be a lot more to look forward to. So, Patrick, tell us about this new project in Gonzales.
So thanks, Hillary. Let's see, this has basically been a 5-year effort to get to where we are today. And as you can see, it's the Dennis and Janice Caprera Community Center complex. We're phasing this project. Basically, a couple of years ago, we realized we weren't going to be able to fully fund it. And we actually have 10 different funding sources. 3 of those are grant applications that we were successful. And they come with, of course, deadlines. And those were kind of bearing down on us, and we needed to pull the trigger and move forward. So we are building. On the next slide, I'm going to show the site layout. But on this slide, it lists. Here's phase 1. It's the Teen Innovation Center. So for the first time, teens and youth in Gonzales will have their own place to hang out. It actually has a couple of rooms, an innovation lab, and then there is a lounge, and then we have a conference room. for city use and other use by others. An outdoor courtyard for functions. It includes an amphitheater for performances, and then of course what we're here to talk about is relocating the Gonzales branch library from the other side of the highway, where it's been, I don't know, for years and years in leased space. So then the future phase is our will be the community hall. So jump to the next slide, please. And so what you see on this is our site layout, and everything in the orange, the orange box is getting built. And so you can see the library definitely at the front and center as you come in off 5th Street. The teen spaces are just west of that. And then you can see the courtyard that we're building, and then all the parking. That's about 100 parking spaces. There'll be I think on the order of like 12 spaces. It says 6, but it's a lot more than it's. We're gonna have 12 spaces for EV chargers, and then we need to come up with another $15 million for the community hall. That's phase 2, and then phase 3 is a potential third building pad. But what we really like about the site is it's across the street from the high school. It's adjacent to the middle school. 5th Street is the main thoroughfare east-west through Central Gonzales, and kids walk back and forth from home to school, and we expect to get a lot of traffic. And I hope there's more youth and adults using the library at this location. So we do call this our community center complex. We broke ground 18 months ago. We expect to finish beginning of December as when I'm going to finish this project. And so I think on the next, oh no, so then you take it over from here. Take it over from here, Hillary.
All right. Well, yes, the library is moving closer to all the schools and then adjacent to the Teen Innovation Center. We will have access to use of that beautiful outdoor plaza. So we're excited, but it's a project. So here are the details for the community to know about our move. Our last open day at our current site will be Saturday, November 22nd. We will then fully close. The bookmobile will start visiting Central Park in Gonzales, right about the intersection of Day and 5th on Thursdays. The phones will be forwarded to our Soledad branch. So anybody calling the Gonzales Library number is going to get their call answered by a real life person. They will just be at Soledad, but have full access to everybody's library card, holds, rerouting items, updates on the project. We are asking people, if you can, hold on to your items, because we're going to have to take out the book drop at the current site and then install the new one at the new site. We do not charge overdue fines. People tend to stuff library books they're trying to return in mail slots or leave them outside the door. We don't charge overdue fines. Don't worry about it. The other thing that is going to move at some point is our strong wireless internet. I do not have dates where it will go down at the old site or come up at the new site. As you can imagine, moving technology is uncertainty until the very last second when it's up and tested. So we may lose our strong wireless internet in Gonzales. We do have them at our other libraries, and our bookmobile brings internet with us. Any community member can use library by mail for free. This is a service we provide for any reason. So if anybody in Gonzales cannot get to the bookmobile stops, wants their items, please just call us and ask for your items via library by mail. We'll mail those items to your home and with return postage. We will open at our new location with the same branch hours. We will then assess hours. We assumed that being near schools, being in this great facility, we would want to look at the hours at that time once the traffic had started flowing. But library hours will stay the same. So with all those plans, Patrick, we have a date, right?
Right.
Tell us about
Yes,
the
we do.
opening.
So ribbon cutting and the grand opening of our community center, phase 1, of course. Yes, as you can see, January 10th at 10 a.m. Looking forward to the community turning out and anybody else who's interested seeing the new spaces that we've built here in Gonzales.
And our certain hope with the library, our plan is to open that day for full service. If there's a little a few unpacked boxes or maybe some technology to iron out some wrinkles, we will open the library for you and be able to provide services the best way we can on Saturday, January 10th, 2026. And here's our contact information. For any further details, please, I'm certain, watch our websites, watch the library's website for any details. And I'm sure City of Gonzales will be putting up any details on when the public can access the community center. So I think that's it for our presentation. Happy to answer any questions.
Thank you so much for talking about this. What a fantastic project this is. And Patrick, I'm going to ask you this question. You probably got just a lot of community input on what Gonzales really wanted for this hub, because it's really going to be a focal place for gathering. Here's the library. It's going to be right in this hub where everybody is going to come and be able to, have events or meetings or services. How is the community feeling about this right now?
They're, as you're mentioning, absolutely looking forward to it. We definitely did a deep dive regarding community outreach and engagement during the early phases of the design. So we definitely took in, as you're saying, an awful lot of input. And another thing that we've done over the last several years is engaging with the Gonzales Youth Council, and because we're giving them their own space for the first time, and they even got to received presentations by the architect and the interior designer, and then even got to understand the fabrics and the colors of the tile, and then even the furniture that's going in. They had sit tests for the furniture, so it was great to see the Gonzales Youth Council being integral to the design of their own center.
And then Hillary, this is just a great place for the library to be. The library's always been in Gonzales. It's always been a great resource, but now you're going to be in the middle of everything.
Yes, I think one of the biggest excitements is a shorter walking distance from all the schools. We knew that we had students who really could benefit from using the library after school, but we're not going to take Fifth Street and walk all the way across the highway to us. And this brings us right adjacent to the schools, right next to the middle school, the high school. And we're hoping that a lot more students and their families will take advantage. The other thing is being in the community center. I've been talking to my staff of anticipate if the teen is doing something in the Teen Innovation Center, we might get the parent and the little kids in the library while they're waiting for that exciting event to wrap up. And we just get that they have to be there anyway. Might as well come spend your time in the library and let us serve the whole family at once kind of opportunity. So we're really looking forward to it. And that's part of why we'll assess the best hours after we move in and see how the community traffic flows through the library.
Thank you both for being here. Such an exciting project. I can't wait for your grand opening.
Thank you.
Thank you.
Some other interesting news coming for South County as well. You may know about the YWCA of Monterey County, the work they do helping women and families find safety and breaking the cycle of domestic violence. But there is something new happening this month, and we're very pleased to have Jessica Macias from the YWCA to share more about this new project and just to familiarize us all with the YWCA work. Hi, Jessica.
Hi, everyone. Good afternoon. Thank you so much for giving us this opportunity, this space to share about the YWCA and what we have going on and some of our future endeavors. I'm Jessica Macias. I'm the new CEO. I'm, just a little over my 3rd month mark. And so there's lots of changes happening, lots of exciting things. I like to say we're in our new era. Everyone's using that word. So we're really excited to just be into this rediscovering era and really getting out in the community. I'm really excited. Again, our commitment is to eliminating racism, empowering women, and promoting peace, justice, freedom, and dignity for all. Everyday survivors turn to the YWCA County for safety, healing, and empowerment on their journey to rebuild their lives, to live free of domestic abuse or violent crime in general, violent abuse. I'm very proud to be leading this agency that has been part of Monterey County since 1913. Our shelter services have been around for going on 55 years next year. So we've been here for a long time, and we hope to be here for another 100 years plus. As mentioned at the YWCA, we help survivors of domestic violence by offering all the support you would need to start your life over. We assist with paperwork, groceries, transportation, basic needs, baby care needs, mental health services, long-term housing plans, and support, and so much more. Every day, our team works to create community where survivors of domestic violence and their children can find safety, healing, and hope. This year, through our shelters and therapy program, our crisis, we also operate a 24/7, 365 crisis line. And we've supported over 1,700 crisis calls, 2,100 shelter nights, and over 1,400 therapy sessions. And we are extremely excited to be opening this new transitional shelter in South County. We do not disclose the location of any of our shelters. We are highly confidential, but we do hope to open our doors by the end of this month. So the week of the 20, I believe it's the week of the 24th. And so hopefully by then we are able to open our doors. We just have some logistics to work out, but we are really excited to be able to open our doors to continue to offer all the same services that we offer through our other programs, housing and shelter. We will be offering them in South County as well. Excited to share that this was our first year that we had the return of our annual luncheon. We hadn't hosted it in 5 years. This was our first year back. So we're really excited that we were able to gather with over 70 community members. We raised some funds, around $8,000, which was a lot more than we anticipated, given that this event had not occurred in over 5 years. So we're really excited to have the community support. And we're also participating in MC Gives this year for this holiday season. And forgot to mention, our transitional housing in South County will have a total of 10 beds and a crib. So we have a total of 11 who are able to get housed in this 3-bedroom location. Again, we're just really excited to continue to offer our services and expand our programming this year. We do hope to host a Walk a Mile in Her Shoes, as well as that will be in the spring, as well as our 40-hour domestic violence training, which will also happen early next year. This couldn't happen without our partners, our supporters, our community members who continue to believe in our mission. I hope to collaborate with as many agencies and elected officials and community members that would like to partner with us to continue to help Monterey County thrive. Together, we are creating pathways to safety, healing, and hope, one family at a time. So thank you so much for this time to share.
Thank you, Jessica, so much. And it's always great to talk about all the work that you do. People know you're there, but they really know you're there when they need you. So tell us a little bit more about the decision to move into South County, because did it require, had you been thinking about it? Had you tried to pull the money together to do this? Because just starting a transitional housing someplace isn't something you do overnight.
Correct. Yeah. So we had been thinking about it, as well as the community has voiced that, unfortunately, due to transportation, they would not drive into the city or into Salinas if they were out in the rural, in our rural towns. And so because of that, we really we wanted to find a way to bring the shelter to South County, for that reason that we're not able to capture some of the folks who need help because they can't get to our office in Salinas. So that was one of the main reasons. The other one, we were able to secure some funding through HUD to open this additional transitional housing. They're covering partial, so we're still trying to figure out other grants that can cover the other part of it, and continuing to provide those services. We also work closely with the Family Justice Center, and we know that the need is there for housing services. We go out there once or twice a month for housing support. And now we'll be closer in the area to be able to provide those supportive services that our rural towns need.
So Jessica, for residents who are in this kind of the general South County area, if they have a need, they should use the numbers, the contact information that is already available and not be afraid to ask about what's available. May only see Salinas on the website yet. They don't have, they should call if they're in South County.
Whenever anyone needs any help, they can call us here at our office, 831-422-8602, or they can call our crisis line number, which is 831-372-6300, to see what's available for us to do a proper intake. We also offer, if there is an emergency need and we do not have space at any of our shelters, we do have the capacity to offer a couple of hotel nights. We have some funding still available for that for this year. And definitely not be afraid, even if it's a loved one that you're concerned about and you want more information, although you cannot do the intake for them, please call and find out if they qualify for our services. If they need help, encourage them to call. One thing I've learned in my 3 months working here is that folks are just really nervous to call and scared, which is why we hold dearly to our shelters and as much confidentiality as we can, to help folks feel safer that they will be in a place where they won't be able to be found. And we're excited to open this new shelter and continue that work.
Jessica, you've really hit the ground running in just 3 months. You've got a lot on your plate. Thank you so much for sharing about this, and really congratulations on being able to add, at this time when there's a need, as opposed to, there are times when you've got to scale back and you're just moving forward.
Yes, we're going to do what we can while we can.
Thank you for joining us today.
Thank you.
And another thing that's happening this month, Thanksgiving. And if you are one of those people who is doing a holiday meal for 1 or 20, now is the time to get yourself organized and get your plans and gear for food from kitchen to table. So we're very pleased to have Edna Botello with our Environmental Health Division to talk about safety issues. We're going to leave taste up to the cook, but we want to have Edna talk about the safety issues.
Hello, good afternoon. Can you guys hear me clearly?
Sure can.
Okay, I'm going to go ahead and share a PowerPoint. Okay. Am I sharing?
We see you. Looks good.
Okay, great.
It's lunchtime. Makes me hungry.
Yes, so good afternoon, everyone. Once again, my name is Edna Botello, and I am with Monterey County Environmental Health Bureau. So today I'll be sharing a few quick but important Thanksgiving food safety tips to help you and your loved ones enjoy a safe, healthy, and delicious holiday. So let's start with why food safety is especially important this time of year. During Thanksgiving, we prepare a lot of food, often in big batches, and sometimes that food sits out too long or is not cooked properly. That's when foodborne illness can happen. Turkey and the juices, it can carry germs like Salmonella, Clostridium perfringens, and Campylobacter, all of which can make you and your family very sick. So for example, most people with Salmonella infection can experience diarrhea, fever, and stomach cramps within 6 hours to 6 days after eating contaminated food. And symptoms can last several days. And that's really not how anyone wants to spend their holidays. Another common cause of illness during the holiday is Clostridium perfringens. This bacteria is linked to foods like meat, poultry, gravies, and leftovers that are cooked in large batches and kept warm for too long. Symptoms include diarrhea and stomach cramps within 6 to 24 hours after eating contaminated food. It is a short-lived illness, but it can ruin your day, and it's completely preventable. And it's also, a lot of the outbreaks occur most often in November and December. So definitely it is linked to a lot of the holiday meals, turkey and roast beef. So with that, what are some essential food safety practices? I will be covering that today. So food handling, turkey preparation, and some buffet safety tips that and proper food storage that you guys can follow during this Thanksgiving. So now let's go ahead and talk about simple ways to keep food safe. The first one is hand washing. So probably most important step. This is the one that we want to make sure everybody is doing. So washing your hands with warm, soapy water for at least 20 seconds before and after handling food, especially your raw or poultry items. And keep in mind that if anyone in the kitchen is feeling sick, it's best for them to sit this one out and not handle food, as a sick cook can spread germs very quickly. Next, I want to go ahead and cover ways that we can prevent cross-contamination. Some of the ways that we can go ahead and do this is using separate cutting boards and utensils for your raw meats versus your cooked foods and your produce. So a simple way is, if possible, using color-coordinated cutting boards. That way you can go ahead and have everybody that's helping in the kitchen be able to follow that through. Another important thing is to keep your raw turkey juices far away from foods that are ready to eat. So this would be like your salads or any desserts. And after preparing your raw meat or poultry, be sure to clean and sanitize your kitchen utensils and surfaces, washing your cutting boards, your countertops and utensils with hot soapy water. Then sanitize with 1 tablespoon of bleach per gallon of water and letting them air dry completely. And here's an important tip. It's not recommended to wash your turkey. Washing can actually spread bacteria around your sink and counters. But if you do wash it, then make sure that you sanitize the area afterwards. And also you can add that simple solution to a spray bottle. That way you can wipe down your countertops as well. Now we'll go ahead and go into turkey preparation. So first of all, we do want to make sure that we're buying our food from approved sources. So buying food from a facility that is permitted with the health department. This is to ensure cooking is conducted in an area that is routinely inspected by our department. The next thing I want to go ahead and go over is proper thawing. So never thaw your turkey by leaving it out in the counter. When you're thawing your turkey, instead, thaw it in the refrigerator, allowing 24 hours for every 4 to 5 pounds of turkey. You can also use cold water method, but if you do want to make sure that you're changing the water every 30 minutes for this. And for this type of method, if you thaw this way, you want to make sure that you're cooking your turkey right away after thawing. And now we'll go ahead and cover some of the cooking temperatures for your turkey. To be safe, use a food thermometer to make sure your turkey reaches an internal temperature of 165 degrees Fahrenheit. And there's 3 locations that we want to make sure that we're checking with our food thermometer. So the first one is the thickest part of the breast, then the innermost part of the thigh, and the innermost part of the wing. And if you do cook stuffing inside the turkey, make sure it also reaches 100 degrees Fahrenheit. Or better yet, cook it separately to make sure that it's reaching that internal temperature as well. Now, if you're serving buffet style, some things to remember is to keep hot foods at 100 degrees Fahrenheit or above, and you can do this by using chafing dishes or slow cookers. Hot foods such as turkey, macaroni, and cheese, stuffing, mashed potatoes, and gravy must be kept at or above 100 degrees Fahrenheit, and you can do so by serving them in warming trays, like I mentioned earlier. And for your cold foods, we want to make sure that we're keeping them below 41 degrees Fahrenheit. And you can do this by having them served on ice cold foods such as salads, cranberry relish, deviled eggs, or cold dips, keeping it 41 degrees Fahrenheit or below, over ice will help you do this. And with this, you just want to make sure that you're also remembering to replace the ice as it melts. And another way that you can keep cold foods a little longer is to serve cold foods by dividing them in small portions and then serving them a portion at a time, keeping the remainder of the food item in the refrigerator instead. So never let food sit out for more than 2 hours at room temperature. These type of steps will help you prevent harmful bacteria from growing. The next thing will be proper food storage. So after the feast, store leftovers quickly, and use shallow containers to help the food cool fast and refrigerate within 2 hours. Then you want to make sure that if you're reheating any leftovers, that it is reheated to 100 degrees Fahrenheit, and try to eat them within 3 to 4 days. If food has been sitting out for more than 4 hours, it's safest to throw it away. And just to recap some holiday food safety tips, wash your hands and cooking surfaces often. Cook foods to proper internal temperatures. Keep raw meats separate from ready-to-eat foods. Cool and refrigerate leftovers quickly. It's all about keeping germs out and safety in. And 4 easy steps to try to remember this is clean, separate, cook, and chill. And so this way, Thanksgiving, you can keep your food safe and delicious and practice simple steps to keep your Thanksgiving healthy and enjoyable for everyone. And thank you so much and have a wonderful and safe holidays.
Edna, thank you so much for walking through really a lot of information in a really short amount of time. In your experience, you know, we've been talking about this for a few years. What is the most common thing that people who are cooking the holiday meal that they ask, should I or shouldn't I? What is the most frequently asked question?
So in regards to that, I think thawing the turkey, that is a question that often comes about. What are additional ways to thaw out if it gets forgotten for some reason with such busy season? So that's something to keep in mind. You know, making sure that there's additional steps, like we said, either in a container, if you're going to be using cold water, following those steps properly. That way we can prevent any cross-contamination of those juices in your kitchen sink or whatever surfaces you're using. And then the other thing is also hand washing. I know that we practice that, you know, often, but during the cooking or food preparation process, just keeping that in mind, that if you go from one thing to another task, remembering to wash the hands and having whoever's helping out washing them as well will be very helpful.
And that idea of color-coded cutting boards is a great one. Really
Yeah.
great idea.
Yes, so if possible, you know, there's simple cutting boards that come in different colors. Maybe that's something that will be good to start implementing this holiday and for the rest of the year as well.
Edna, thank you so much for sharing this really important information. And because, like you said, everyone wants to spend their hours after Thanksgiving watching a game, going for a walk, not being miserable.
Exactly.
Thank you for being here. And thanks
Thank
everyone
you.
for joining us on the news briefing this week. Our next briefing is next week. And we'll see you then.